you guys at PEPFAR, of course, you are doing a good job, and you know you are trying your level best. But when you hear, you know, we are not doing enough, what do you say? How do you react to that?
Well, it's true. It's absolutely true. I mean, if there are over 34 million people infected with HIV, there are 8 million people on treatment now, which is a tremendous feat. But as I said, there are still people dying of HIV. So I think you know, when you talk about all the holes being pegged, this is a complex problem, right? And it involves everybody coming together. Secretary Clinton mentioned that the other day. You can't stop the spread of HIV if you do not get in front of it, in front of how sex workers are getting infected, or in front of how, you know, babies are getting infected, or in front of how young people are getting infected. So when you imagine just the breadth of who needs to access services, who needs to, you know, prevent new infections, it is a burden that the world has to carry. So I'm pleased that there are people who are feeling passionate and feeling that, no, we need to go out there and make sure that the commitment to this fight doesn't wane. On the other hand, I would say the commitment of our government, of our people to this fight is remarkable. You know, the United States has never done something on this scale, on this magnitude, for a certain population of people, both Americans who are infected by this disease here in the US and people in the world. So I think that we want to just make sure that the commitment remains, because you need so many resources. You need both financial resources, and you need the commitment of partner governments. When you were mentioning, you know, the legal barriers, the fact that people are living in countries where they're criminalized, you know, because of their sexual orientation, how are those folks going to come out and seek access, seek care? So there are lots of hurdles that we still have to fight, but I think for us at PEPFAR, we feel very much that it is our privilege and honor to have resources provided by our people to help in this fight.
How much is PEPFAR spending so far for the to assist people living with HIV/AIDS?
In FY11, the U.S. Congress appropriated just under $6.5 billion to fight HIV/AIDS. Of that money, 60% of it went to Africa.